So many thanks to the Sheffield Community DSNs who are recording this video to support switching to Novo cartridge pens. So welcome Bridget and Debs.
Thank you. Supplies of the disposable Novo Flex Touch Flex Pen for Tresiba, 100 units in a mil, will become unavailable in the near future. So patients that are currently using this device will need to make a change. There are two Novo pens available, the Novo Pen 6, which will be most appropriate for most patients, but also the NovoEcho would also be an appropriate pen. The Novo Pen 6 dials up to 60 units and increases in increments of 1 unit, so the same as the Flex Touch pen. The difference with the Novo Pen Echo, which the cartridge would also fit in, is that this pen has a maximum dose of 30 units and dials up in half unit increments, which is different to what patients will be used to. We rarely use the Novo Pen Echo for patients with type 2 diabetes. So the video is designed to support the transition from using the Novo Flex Touch Tresiba disposable pen to the reusable Novo Pen 6 and 3 ml insulin cartridges, and we will highlight the differences between the devices. Primarily, as the Novo Pen 6 is a reusable device, the patient needs to replace the insulin cartridge when the current cartridge is finished. This is very similar to changing a battery. Firstly, remove the lid from the Novo Pen 6, firmly twist the pen device, and the pen will come apart in the middle. Ensure that the twister is pushed all the way back inside the lid, and the new cartridge can now be inserted into the other half of the pen. Screw the two halves of the pen back together, but firstly, ensure that the cartridge contains the correct insulin, is in date, and has no signs of damage. Any used cartridge needs to be disposed of in a yellow sharps bin. A new needle should be added for every injection. Remove the paper cover and screw the needle onto the end of the pen. Remove the outer and inner covers if one is there. A 2-unit test shot should be carried out before every injection using any pen device to ensure that the pen is working and that the new needle is working. Pull out the end of the Novo pen, dial 2 units and watch to see that insulin is released when the plunger is depressed. You can repeat this 2-unit test shot as many times as necessary until insulin can be seen to be released. The patient should then dial their usual dose and administer their insulin. The needle should then be removed after every injection and disposed of in a yellow bin. Any brand of pen needle will fit onto any of the pen devices available, so there should be no need to change prescriptions for needles. Any disposable pen containing insulin or any insulin cartridge, when in use, should be stored at room temperature, and the individual cartridge or pen will remain in date for 4 to 6 weeks, depending on which insulin it is. Any insulin not yet in use needs to be stored in the fridge, and in the fridge it will have a long expiry date as indicated on the individual cartridge or pen. Every patient will require a prescription for 2 Novo Pen 6s so that they always have a spare should the pen become faulty. The additional benefits of using the Novo Pen 6 and cartridges is that less plastic will be disposed of every month, and also that the cartridges are smaller and so take up less space for the patient who needs to store them in their fridge. Additionally, the Novo Pen 6 has a memory function. This can be used by the patient to check when they last gave insulin. Pull out and push back in the end of the Novo Pen 6. The number shown at the top of the display shows how much insulin was last administered. The numbers at the bottom of the display show how long since the pen was last used. So it's a really helpful reminder for patients. However, it may be more difficult for some patients with dexterity issues to use the Novo pen. Those on higher doses will need to depress the plunger of the Novo pen for longer compared with the Flex pen. And this may be difficult for some patients, and they may need to learn a two-handed technique. It's important to ensure, therefore, that the patient can use the new device before changing the prescription. Thank you.
Thank you very much.
We're now going to add some slides that cover the key points. Thank you very much for your attention.